Well, ladies and gentlemen, a very warm welcome to ecancer and to a special series we're doing on Ukraine and cancer and conflict. I'm Richard Sullivan from King's College London. It's hard to believe, but we are nearly a month shy of the 1-year anniversary of the brutal Russian invasion of Ukraine in February 24th, 2022. A lot has happened since then. We last spoke to the cancer community back in May, June last year to understand what was going on around Ukraine, what sort of actions were taking place outside Ukraine for hosting refugees. And since then, of course, we've entered a new phase of the war. The war has moved backwards and forwards dramatically. There've been attack against infrastructure. As the Financial Times said, it's been waging a war on healthcare. Joining me today to bring us up to date on some of the work that they've been doing and some of the actions that they've been engaged in is Dr. Horia Vulpe and Professor Ruslan Baltaga. Professor Ruslan Baltaga is the director of the National Cancer Center in Chisinau, Moldova, and he's speaking us today actually from the Ministry of Health there. So very warm welcome, Ruslan. Thank you for joining us again today. And Dr. Horia Vulpe from the Blue Heron Foundation, medical director there, but he's also a radiation oncologist and director of quality and patient safety at the Queen's Medical Center in Honolulu. He's been doing a lot of work, Blue Heron Foundation, also working with Ruslan, and he'll bring us up to date on some of the actions that the Blue Heron Foundation have been engaged in. Ruslan, can I just come to you first of all? We obviously talked in June about some of the challenges you were experiencing, looking after not just your own domestic population, but also the influx of refugees, many of whom diagnosed with cancer had to be treated within your centre. Tell us a little bit about, since June onwards, what's been going on. What are the challenges have you experienced and what have you been doing about this?
So a lot of things happened since we spoke last time. We were continuing to look for the ways to improve our cancer control capacities. In April, we had a mission of WHO. It was an urgent mission to evaluate our urgent needs in helping refugees, but to adjust our cancer control process in Moldova. Since then, we had challenges with increasing prices. We had interrupted the processes of bringing the materials, medicaments, and so logistic problems which were related to war and obviously the crisis of refugees. So we had to tackle all problems at the same time. We had, during this period, great support from our national and international partners, from WHO, International Organization of Migration, Ministry of Health, World Bank, as I'm coming now from a meeting discussing the need to buy for our institute an MRI for planning and diagnosis. As well, we have progressed with the International Agency for Atomic Energy in the next program for procurement of a new linear accelerator, and in parallel we are developing a project for construction of a bunker. We have signed already the contract for modernization of brachytherapy from 2D to 3D. We had a very busy year, and it was expected due to post-pandemic. We had last year 8,000 of new cases in Moldova, Moldovan cases. This year we have 10,300, and it's for the first time at the Oncological Institute we had 29,000 admissions as inpatient, and 231 visits. It's one of the peculiarities of our country. It is the only center which does comprehensive treatment, and among our other partnership, I'd like to mention those which came from our network. For example, we became members of OECI. As a result, we are associate partners in two horizon projects. One is CCI for EU, another one for cancer survivors. As well, I'd like to mention the work which has been done in supporting and treating refugees with circular migration. Initially, we were covering only emergencies. Then we had the option to relocate patients in EU, which was a problem due to refuse, but to logistic problems as well. Then with support of Ministry of Health, we were in touch with the International Organization for Migration and the Blue Heron Foundation. We had, I would say, very good, fruitful cooperation, a lot of new contacts, a lot of empathic people, model people. One of them is Horia, who visited many times our country. He visited Kiev and Ukraine as well. And I would say, main goal was treating patients. We had so far around 500. I don't have the numbers exactly now, but I would say those who addressed to oncological institute. Some of them were treated in Romania, some of them in oncological institute. We have increased the capacity of radiotherapy, 500 patients more compared to last year, since we had a new linear accelerator installed in February last year. And as I said, as secondary or side effects of our cooperation was organization of educational programs, organization of training programs for our residents in radiotherapy. We have two new fellows in radiotherapy, and Horia is joining our faculty. We are doing research in help of refugees, but not only refugees, but immigrants as well, because a lot of our population is migrating in and out of countries. So, I mean, this is a part of activities which has been done during this period. Obviously, we still could have done better. We had the problems like lack of capacity in, and maybe you can suggest some help in design and projects, in complex projects like medical laboratories, operating theaters, bunkers. Horia and his colleagues as well helped us together with International Atomic Agency. Other projects we might need support is, for example, and I thought about OECI maybe in cancer economics. We were trying to secure some funds to do because all the costs have been changed, and we need to do some evaluation in this area as well. Obviously, lack of funds, deficit of resources. We had to manage with existing resources to improve our capacities, and to so basically we managed with not increasing resources, but we managed to increase the patients we have treated on top of our increase, plus 3,000 patients compared to last year. So on top of this, 500 refugees. So that's so far.
That's some extraordinary progress you made. I mean, I think when we last talked in June, of course, you were still balancing out and struggling, dealing with that initial influx of refugees, and obviously going forward in planning. I'm going to pick up in a minute after we've talked to Horia about the future as well, and what you're looking forward to in terms of additional resources and what sort of support. But Horia, can I turn to you next and just ask you a little bit about what's been happening since June last year for the Blue Heron Foundation? What have you seen in terms of transfer of patients? Give us a sense of some of the challenges and some of the solutions you've been engaged in.
Thanks, Richard. Thanks for having me. Again, it's really great to follow up on our progress. So a lot of water under the bridge since June. If people will remember, that's when we transferred our first patient from Ukraine to Romania for cancer treatment. Since then, we've evaluated over 170 cancer cases, and we've assisted 95 patients. This is both in Moldova, where we cover the costs of care for the treatments of cancer patients, whether it's chemotherapy or radiation or surgery. And that's where we partner with the International Organization of Migration, who helps us cover everything that's before treatment, so biopsies and scans and so forth. And we've moved patients to Romania who needed assistance both from Ukraine and from Moldova. And there we have a team on the ground that is helping them with transport, interpretation, translation of their files, navigation of Romania's healthcare system, and they get seen at our partner clinics that have been very welcoming. And it's been such a pleasure to work with people in Moldova and in Romania on this. Everybody's really willing to help. And in Romania, we can register refugees in a single day, and on the second day, they can go see the doctor already. So we've really diminished some of the barriers to accessing quality care in the EU, in Romania. And we continue to work with Ruslan's team and the doctors there to subsidize the costs for the patients in Moldova who don't have access to healthcare, anything more complex than things like emergencies and vaccines and HIV care.
And might just follow up on that. Have you seen any changes in the profiles of the cancer patients coming through? Have you seen any dramatic spikes since June, or has this been really just steady numbers coming through month by month?
Interestingly, and in a way that was lucky for us, it's been pretty steady. The times that we've had a big influx of patients was after we've advertised it with patient organizations within Ukraine, like the Inspiration Family or Mission Kharkiv. They're good partners of ours. So when they've put out a Telegram advertisement, then we had more patients. But other than that, it's been a pretty constant influx of patients. And it also is related to the treatments that are lacking in Ukraine because of the war. For example, the medication Herceptin for breast cancer. As the stocks dwindled and patients couldn't afford to get it anymore, we've seen more breast cancer patients come. So we have a number of young women in their early 30s who we're treating in Romania because they couldn't access Herceptin in Ukraine. And we have a variety of cancers as well. We treat patients anything from surgeries to radiation to chemotherapy.
So you both made the very good point. Of course, this is all dependent on funding going forward. And one of the critical issues moment we're talking about is not just what potential costs of reconstruction with, but right now, how to continue funding the National Cancer Control Program within Moldova, the Blue Heron Foundation, and with, in a sense, with having no end of the war inside. And Ruslan, maybe I come back to you to begin with, and I guess what are the key things you're looking at now for 2023 in terms of further support from the World Bank, from other international donors? What's the kind of political economy of cancer for Moldova? What does the future hold?
So we are finishing now the revaluation of the second part of our national cancer control program. So we will focus on public health aspect of early diagnosis and screening, mammar screening. We had a program, we had a mission from European Institute of Cancer. Dr. Cassano from Milano has visited, being supported by Organization of Migration. So we just had a meeting today to finalize these prospects and the migrants. Not only refugees, but migrants, all sorts, will be included in this process, because we have to adapt to, in this part of the world, in Moldova, not only refugees is a challenge, but migration process. We have estimated out of 4 million of our population, 1 million is migrating, transborders, seasonal workers, people who live abroad come here to see parents and so on. So this is another issue as well. So we want to adapt to this one. We are implementing IFOP screening for colorectal. We are doing some colorectal screening for people from family with history of colorectal cancer, but not in general population. So this is one of the long-term projects which we understand if we don't implement now, we will continuously, like we say, go after the train. So we will not be able to stop the train. So we want to invest in this process as well. Second is we are making efforts supported by our partners in improving our capacities. Radiotherapy is strategic because we are the only center which provides, and the WHO mission has estimated that we need 8 accelerators. We have 2, one is on the way to come, so we have to improve treatment diagnosis as well. We have installed a new mammograph with tomosynthesis for diagnosis. In treatment, we are improving our surgical capacities, so our plan is to renovate the operating theaters. As I said, it's one of the challenge here is difficult to find a good company. Well, you can find a company, but it would be too expensive to cover for us, especially engineering aspect like ventilation, all the engineering parts. Then other aspects of cancer control, like medical oncology, we have made the request for medicaments the previous year, 2021. So basically, I would say otherwise. We have increased our medicaments which we have contracted for the next year plus 50%. So it was 100 millions, now it's going to be 150 millions. And according to WHO mission, this will be covering initially the basic needs and those treatments which are evidence-based. We still have challenges in palliative care and rehabilitation, and we would need as well some support in improving our cancer registry, which still is not connected to our IT problems. Maybe a project, if we could find a project to unify all our IT system. It's a weak point as well, so in this period of time. So briefly, what we are looking forward in the next period.
That's hugely helpful. I'd say you've got a lot on your plate at the moment to do. And Horia, maybe same question for you in terms of Blue Heron Foundation. What the finances? How are you approaching sort of the economic challenges going forward?
That's one of our biggest concerns is how can we keep going to support these Ukrainian refugees, both in Moldova and Romania. And surprisingly, there are not that many sources of funding for this. There's a lot of grants from various agencies that are focused on innovation and research, which is great. But in a time of war, you also have to have money to support the direct treatment of patients and their support for accessing care and the standard of care. And we continue to fundraise, but we would love to see a more stable source of financing for Moldova so that we know that the cancer patients who are on treatment will continue to get their treatment, that new patients will have access to the medical system there. It's great for us to fill this gap during a time of crisis, but we're a small team. We're doing a lot with the funding we have, but really we'd like to see some more support for Moldova so that they can have a stable solution for these refugees. And similarly for Romania, even though it's EU and the care is technically covered, there are all aspects of navigating patients and getting them set up that are costly with coordinators and various interpreters that also need funding. So funding is really our biggest problem, and we'd love to see some of the bigger players come here and help.
That's a fantastic place to end on. I think it's a great call. Ruslan Baltaga, Horia Vulpe, thank you so much for joining eCancer. You've done extraordinary amounts of work to help Ukrainian refugees, migrants, your own country's fellow citizens as well. We really look forward to talking to you again over the next few months. Every good wishes, and thank you so much for all your work.